What did I mess
Yeah,
up?
I know. I was
Yeah,
like, it's 5 till, 3 till.
yeah, yeah.
Hello, everyone, and good afternoon, and welcome to another one of our Admissions Dean's Corner. And this one is covering personal biography and dental experiences. My name is Suleima, and I am the TMDSA Support Coordinator. And I'm so excited to have with us Dr. Ralph Cooley and Dr. Kelly Lemke from the dental schools. So, just to give you guys a breakdown of what these sessions are about, they are designed to offer you guys, the TMDSAS applicants, a little bit more comprehensive information about an overview of what it takes to stand out as a competitive applicant, whether you're a dental, medical, podiatry, or veterinary applicant. These kinds of sessions will host the deans from the admissions and will emphasize the importance of going beyond the GPA and test scores. So, in this case, we'll talk about activities. And we will also present you with well rounded information to create an authentic application. So again, I'm so excited to have Dr. Kelly Lemke, the Director of Admissions at the University of Texas Health San Antonio School of Dentistry, and Dr. Ralph Cooley, the Assistant Dean of Admissions and Student Services at the University of Texas Health School of Dentistry at Houston. It's a mouthful.
Yes.
All right, and so they'll give us insight again, personal biography and dental experiences as it relates to holistic review. If you have any questions at any time, go ahead and enter those into the chat, and we'll have a few moments at the end to address those. And so, yeah, I'll go ahead and start it off with you guys. If y'all want to introduce yourselves and perhaps give us a little fun fact about yourself.
I'll let Dr. Lemke go first.
Ladies first.
Yes.
Um, well, you can see my name there. I'm Dr. Kelly Lemke, and I am the Director of Admissions here in San Antonio. And let's see, fun fact about myself is, let's see, I like to knit, I like to run. Um, I have a couple dogs I walk every day, and when I do Zooms with pre-dental students in the evenings, I've had to add a disclaimer that Theo and Penny might not behave during during the Zoom. They are special guest stars, but they're at home today, so we're safe. And let's see, a little bit about myself. So I'm actually a graduate of my own dental school. I graduated in 1995, and then I went out to practice. I took a few years off from practice while my kids were very small. And the way I ended up in my current role was that I gained some experience in working in dental literature. I work for an international publisher of dental textbooks and journals. And based on those skills, I got a part-time job at the dental school working on a project. And I feel like my career kind of just grew holistically from there. And I picked up a master's degree along the way, and I started teaching and became full-time faculty. And then when this position came available, I applied for it because I thought this sounded like a great way to contribute to the future of our profession. And so here I am, and I have been in this role about 2.5 years now.
Thank you so much.
And I'm Ralph Cooley, and I would tell you that a little bit about myself. I practiced after graduating from dental school. I practiced 34 years in Conroe, Texas. Had my practice there, and I taught one day a week at the dental school for 14 of those years before coming here full time to the dental school 10 years ago. And the reason I did is I just knew that this is what I wanted to do the last part of my career. So I have a pretty good feel about how dentistry is practiced. And by the way, my practice, somebody bought it and they're doing well, and they even treat my family members up there. A little fun fact about me is baseball is a big part of my life. You can't see in my office, but I have bats and balls and pictures everywhere around. I played at Rice University. I played 4 years for the Owls, and then I coached teams for more than 20 years, all the way from Little League beginning to high school select, where players went on and played in college and played professionally. So my grandparent name is Coach. So I like doing that, and that's the reason I like being in this position, because that's what Dr. Lemke and I do at our respective schools. We do a lot of coaching of not only students here, but pre-dent students that are trying to get in. So anyway, glad to be with you today.
Yeah, thank you guys so much for telling us a little bit more about yourselves. I feel like I know y'all a little bit more now. So thank you, and very fun facts for sure. I also wanted to give you guys the opportunity to talk a little bit about the schools that y'all represent because, you know, we have 4 dental schools, and I think it's an awesome opportunity to give us a little bit more insight about y'all's schools before we start. And Dr. Lemke, we can start with you.
So our school has about 18 programs that we offer. And so the DDS degree that I think people who are viewing this YouTube right now are interested in is just one of those. And so people who come to our campus have the opportunity to interact with all kinds of learners, hygiene and people who are training in specialties, as well as all the other schools across our campus. Similar to Dr. Cooley's school, we have the dental school is only one of six schools on the UT Health San Antonio campus. So there's a lot of opportunities for our students to interact with learners of other types. We kind of pride ourselves on the amount of clinical training that we provide our students every year. I just attended a presentation by our dean about how much clinical care that our pre-doc students are providing. So these are our 3rd and 4th year students. And in 2023, he told us that they did like a little bit over 90,000 procedures. I think it was 91,000 procedures in a year. For about 45,000 patient visits. So that's a lot. And interestingly, a couple thousand of those were emergency care visits. So lots of opportunities for our students there. And our clinic is a freestanding 4-story building that is just a couple of stoplights down the road from the building that I'm sitting in right now. And what else? Oh yes, and we have a student chapter of the American Academy of General Dentistry, and so that student chapter just won Chapter of the Year nationwide. They're very blessed to be supported by some really good faculty that support their learning as practitioners, even while they're still in school.
So. The lights went off in my office. Whenever I'm not the front part of my office, they think I'm sleeping, I think, back here. So they turn the lights off. So I apologize for that. You know, Dr. Lemke gets tired of me saying this because we do a lot of programs together, but it's really true that we've got 4 great dental schools in the state of Texas, and I'm really proud of. We don't view each other as competitors. We're colleagues and we're friends, and we're really blessed because all 4 schools are great. I would tell you, I'm proud of our school. I just got back from the state meeting in San Antonio last week, and we had great representation there. Our students are leaders in ASDA, the American Student Dental Association. They're involved not only getting good education here, but they're involved with what dentistry is going to be like outside. But here at our school, just like San Antonio, there are a lot of organizations that they're involved with. There's over 20 organizations. I'll just give you an example of one. Our Texas Association of Women Dentists just held a fundraiser last month, and they raised a little over $15,000. Wow. And I asked what that was for. That goes to a home for battered spouses and children to provide school supplies, clothes, you name it. So the students aren't just pocketing that money and going out and having a good time in downtown Houston. They're doing that for the benefit of others. And community service is big for us. Last year, we did over $1.5 million of community service at outside dental clinics where our students actually go. They are the doctors, and a mobile van that goes out every week to different rural parts in Texas. So I think that's what dentistry is. Dentistry is a lot of service, giving back, taking care of patients, not only in our facility, but even outside. And both of our schools do that. So that's it kind of makes you proud to be a dentist and a dentist in the state of Texas.
Yeah, thank you guys so much for sharing about that. There's definitely a lot of community engagement involved at y'all's schools, which I think is also another perfect way to take us over to the topic for today's session. So for the activities, um, you know, it's a lot of times our applicants get very anxious about what to put in there, how to enter their activities. And so I'm just curious if you guys had any ideas for we mentioned a lot about holistic review, and so that's kind of like the lens that we let the applicants know that they can utilize those core competencies that are listed on the ANC website to kind of give them an idea of what the holistic review looks like and how to take that and use it to help them enter in their activities. So any insights would be helpful.
Okay, we can just bounce this back and forth. I
Sure.
don't want to make Dr. Lemke go first all the time. Feel like I can go ahead. I would tell you on this, the personal biography, the big key, and we all say this is really tell your story, tell your own story. I think there's this pressure that, especially on the essay part or anything, hey, I've got to make it look like if they took my life, they'll make a Netflix series out of it. No, it doesn't have to be that. Everybody's journey is unique. And I think what we look for is authenticity and, what your journey has been, what you've been through, what hardships you've had to overcome, mentors that have played a role, but really just telling your story with it is what we look for. And everybody's unique with this. And it's always good. And we always say, have somebody look at it that you really trust. That may not necessarily be AI that you trust, but look at somebody that you trust to look at it, and then have somebody that maybe doesn't know you as well look at it and say, does this make sense? If you were reviewing this, do you get a sense of who I am? So I would just lead off with that.
Yeah, and I mean, to bounce right off of that, I think that all of the dental schools in Texas value well-roundedness in an applicant. And because that is those life experiences you gain from all kinds of activities, jobs, leadership roles, all of those things, they make you a whole person who is ready to care for other people in the dental setting, as well as be a team player alongside other students. And so well-roundedness it's valuable. And so that doesn't mean just dental shadowing and all of that. That also means all of those other things you do while you're a student, the clubs you join, sports you play, anything like that. And so as Dr. Cooley said, make sure you have somebody read through it, but also don't rush through it. So you make sure that you're listing everything you did in college, both dental and non-dental activities. And I think that when you enter these activities, you have the 500 characters, I think, to describe the activity. And then if you want to make it one of your meaningful experiences, like perhaps it was shadowing or a certain volunteer role, you have more characters where you can describe how that's meaningful. And I think that that's where the applicant has a chance to connect the dots for us about how like what you learned, what skills you learned, what strengths you learned, what did you learn about yourself or other people by participating in that activity. It's not just the activity, it's what it brought to you, and then what you can take into your career as a dentist, as Dr. Cooley said.
One of the things that I heard this advice a long time ago from a dentist much smarter than I am, that said, when you're writing something like this, if you're writing along or you're typing it or however you're doing it, you're dictating it, just know that at the top of that, you should put RRRRRRRRD. You could continue those R's, and it just stands for rough draft. And it kind of takes the pressure off feeling I got to, this got to be really good and perfect. You just got to throw it out there because you're going to massage it. And as Dr. Lemke said, you got to take your time. You're going to write, rewrite again. You're going to change it around until you finally say, okay, that's it. I'm sick of it. This is it. You're not sick of it, but this is it, and I'm turning it over. So it kind of takes the pressure off feeling you got to do it perfect or close to perfect the first time.
Yeah. I would never try to do this all in one sitting. Always sleep on things. You know, another quick piece of advice would be to not don't feel like you need to inflate any numbers on your application, like the numbers maybe you spent in some activity. You know, doing that can take away from the credibility of the application, but also we're just looking for the genuine experience that is you, the applicant. And so you don't need to inflate the numbers, just, be honest about how much time you spend in these activities for us.
It says on there too, common mistakes to avoid, and I will tell you the one that gets me. I mean, we could talk about grammatical errors, and yes, if you have one or two grammatical errors, that's you're not going to get. You're not going to super penalized that. If you have 25, that's a different story. But the common mistake that we don't like to see is negativity. So if you're talking about everybody has had to overcome challenges or had problems, and I know life is not fair, but I can tell you this is a live broadcast because they're getting ready to water the plants in my office here. So if you see people around me, this is really live. No, but negativity, if you've had to overcome something, tell us, how that made you stronger or what you learned from it. And I know life isn't fair, and I know there's some times it'd be nice to complain, but the written part or the application is not the time to do that. It's the time to say how you are a better person and stronger and more resilient because of it.
Yeah, thank you so much for providing that insight, because I'm actually very glad that you addressed the mistakes that, sometimes we would get calls from applicants that said, I left out a period at the end of my essay, or can I change it? And I'm like, well, we're all human. I understand, and I understand the pressure of wanting to make sure you get it right, but I in my perspective, I said, I don't think one missing period compared to if you
No.
had many missed typos and whatnot wouldn't make a difference. They wouldn't necessarily toss out your application after that. So I do appreciate you for bringing that up.
Another thing though too, very few people make this mistake now, but occasionally, is you don't want to write it where you feel like an ophthalmologist needs to do some work with it. What I mean by that is the essay has an eye infection where the pronoun I is in there like every sentence or every other sentence. I did this, I did that. So you have to you kind of want to sell yourself, but you don't want to come across as like, I'm the wonderful, wonderful person, and it's a little tricky. You got to have a little sense of humility as well as confidence in there.
Yeah, thank you guys so much for this insight. Because I have learned a lot, so that way I can, whenever I get these questions over the phone, I know what to say now. Alrighty, so moving along, so there's a section that is specific for dental applicants, and this is the manual dexterity. And this would be our second year having this category in the activity. So this always trips up applicants a lot, and they're always wondering, what do I put in here? So any insight as to examples of what you would like to see in this category? What kind of activities are you anticipating to see, and how can they talk about those in a way that's impactful for their application? And anyone who wants to start first.
I mean, for me, of course, last year this was new, like you said, so now we're going in the second year. When I look at this section and my committee looks at this section, we read the list, but we don't make assumptions about the applicant's hand skills based on the list. It's just a list of things that have been inserted in the application. But I think what we can gain from reading what people list is something that tells us whether or not they like to work with their hands. So a history of hobbies or activities that involve the hands is a good signifier of that. And some of the examples, like I didn't knit, in my younger age. It was a post-dental hobby for me after school. But I grew up needle pointing. So if I were to fill this out, I would list like embroidery and sewing. But there's a long list of things that we see listed here. And I'll let Dr. Cooley give his opinion, and maybe the two of us can together name also some of the things that we read.
So I think Dr. Lemke explained that well. We've talked about this before, and I think our views were pretty much right in line.
Mm-hmm.
I mean, we view it, and to me, it's great you're doing that. It kind of shows well-roundedness and the activities you're involved with. I think we don't want to make the assumption that just because you're really good, let's say, at crocheting, that means you're going to be a brilliant oral surgeon, right? So because at all of our schools, we're going to teach you the hand skills that you need. And it's essentially, dentistry is like it's like microsurgery. It's fine surgery. And everybody that comes in, nobody's perfect. Everybody works, and it takes a lot of discipline, a lot of practice to get to that level of expertise. And it's great to put it on there, and we look at it, and it does make your application more complete. But we don't look at it and go, oh my gosh, okay, they're going to be so gifted in dentistry, because it doesn't always translate that way. But it's good to have it on there. We look at it.
And I was thinking myself about the people from my dental school class, and this was 3 decades ago. But the people that I knew best, who had just like hands of gold, one, his hobby was golfing. I mean, that's not really a fine motor skill. Maybe I don't golf, so who knows? But and the other one was into jewelry making before he started into dental school. So I would say one had a history of doing things with his hands, like little motions, minute detail, and the other one held a golf club, and they both did amazing dental work. So Dr. Cooley, what are a few of the things that you've seen on applications that on this list, just to help our viewers out?
So, you see anything like people that are sewing, they're into arts and crafts, I've seen it before on jewelry making. I've seen it into, I haven't seen any tattoo parlor
Not
people,
yet.
but I have seen, and I can't remember the term. What is the term my friends of Indian descent do?
They do henna.
Henna, yes.
Yeah.
Seen that.
Nail art.
Pardon me?
I see nail art.
Nail art, yes.
Drawing.
Right.
Musical instruments, certain musical instruments, things like that.
Yeah, anything playing. We were talking about this morning with a person, somebody who was very gifted on the piano. Well, that's good. I mean, you've got, but that's a start. But again, it's going to be a little different with dentistry.
Yeah.
Thank you guys so much for providing examples. We did have a question about an example of what that could look like. So I'll go ahead and just ask it here since we're on the topic. But this is, can I add fabricating temporary dental crowns as manual dexterity skill?
I'll just give you my opinion. I would say yes.
Yeah. I think I saw that on applications last year. So, yeah.
And I started to say too, the people that have worked in a dental lab where they've had to, of course, that's kind of a little bit of a dying occupation, a little bit with all the digital things we do today. But if you've worked in a dental lab, but again, if you've been an assistant and you've made temporary crowns, yes, I think that counts. I think that's good.
Okay. And another question I have here, and these are, I'm just going to go ahead and pick out the ones that are related to the topic or what we're discussing. But this question is, if we won an award at a pre-dental day, would I be able to add this under manual dexterity?
What is it? I'd like to know what the award is. Is it best? If it's best dressed, I would say no. So if it's like, most likely to succeed or something. But no, I think if they were doing something and they were doing some dental procedures, if they did that, I think be fine to put that in there. Yeah.
Or they could put it up under the non-academic recognition. I'm having to think here about the
Right.
application. I
Right.
think there's a section called non, and so it could go there too.
Yeah.
Yeah.
And I don't
Great.
mean to make light of that. If you really did that, I would find a section and put it in.
Let's move on. And I know we do have that section, but right now we're going to focus on the dental ones. So yeah, Melody, if you want to go ahead and give us like a clarifying comment on what that award was, and we'll be able to help you out. We'll have our deans here to help you out. So the next section is the dental experience. So this is another category in the activities section. Also important for dental applicants to fill out. So what kind of experiences do you guys see here? And how can they make them relevant and impactful for their application when it comes to dental experiences specifically?
Well, I'll start. I would just say that, I mean, the two obvious ones are shadowing in a dental office and then working in a dental office. And we get this question a lot, is there a difference? People have said,
Yeah.
gee, does that count if I worked in a dental office? Because I'll have to put that under employment. Yes, it counts as dental experience.
Yeah.
The analogy I use, the difference between the two, shadowing is great, and most people can't work in a dental office or don't get that chance. But the difference is it's like watching the game from the stands as opposed to actually being on the field and being in the game if you're working in the dental office. So one thing we're going to bounce this back and forth, but one of the things really important for us when you do that is be very specific when you list that shadowing or dental experience. We want to know who the doctors are. We want to know what the dates are. We want to know the hours. So if you work for ABC Dental and it's 5 dentists, and you shadow or you work for different ones, you need to break that out. One of the things that's a red flag to us is we get on the application, hey, I shadowed 142 hours at ABC Dental over these dates. Really? Who did you see? Well, because dentistry is kind of a small profession in terms of we know a lot of each other
A lot of people.
in the state of Texas. And we probably know some people that worked at ABC Dental, and we want to know who that is, because otherwise it comes across, not that we're questioning anybody's veracity, but it comes across like, did you really shadow 142 hours? And who did you see? So
I agree that lack of transparency isn't good, and you don't want admissions committees to feel hesitant to make a decision because they feel like the applicant hasn't been very transparent. And as Dr. Cooley said, being specific about what you witnessed, what were the procedures you assisted in or shadowed, really helps us to understand like the breadth and the depth of your exposure to dental practice. And as far as shadowing versus assisting, I think that they both have value. And I'm sure Dr. Cooley will agree that a very common question is, if I work as a dental assistant, do I still need to shadow? And, a very common question. And I think that it depends on, is your assisting experience varied enough to give you that breadth of exposure? So if you have been an RDA in one office, you have seen a very limited setting for dentistry. Every office is different. And, so somebody who has just maybe worked in one office should definitely think about, adding some shadowing in other dental offices to their portfolio of experience.
I agree with that 100% because when I graduated from dental school, the guy sat one chair away. We both were C's. We both went to the same town where practices were a half mile from each other. We were best friends. We ran our practices completely different. And I think we both did the best dentistry we could. I think we did excellent dentistry, but we ran the practices different with the way we handled things. And so even if you're working for the dentist of the year, the greatest dentist in the state of Texas, you need to see other people. You need to see how it's done without a doubt. That's absolutely critical. And the other thing too, I know we get this question all the time. Should I see every specialist, or I try to get it in? And you don't have to get every specialist. We like to see general dentist in the mix. Just don't shadow the orthodontist. 5 orthodontists. We love orthodontists, but you need to see different dentistry, especially general dentistry, because that's how you get trained as a dental student. You get trained, you come out as a general dentist. So you need to see those folks. If you want to throw some specialists in the mix, that's great, but just make sure you have a general dentist and as Dr. Lemke said, more than one office.
Yeah, and I sometimes get questions from pre-dental students who are concerned about getting shadowing experiences, and it's tough to make a cold call. If I were looking to shadow somebody, I'd probably start with my own dentist. But as far as getting those extra experiences, the good news is most dentists are pretty outgoing. I think this is a profession that attracts people who are pretty outgoing, and they have friends who are dentists and they refer to specialists. And so, once you have your foot in the door and you're in one office shadowing, I by all means ask that dentist to, refer you to some of their friends and see and say, hey, if you've had a good experience with me in my office, would you mind texting a friend to see me if they'd be willing to have me in their office too. And I think that's just a simple way to build a group of experiences instead of having to make 5 or 6 or 7 cold calls.
Yeah, I think that's great advice. And I was going to say the same thing. Don't be afraid to ask. And also, if that dentist, don't be afraid to ask them if they would be a mentor to you, and write that letter of recommendation, because you have to have a letter of recommendation from a dentist. And I know I had many people shadow in my office, and I'd look around and they had kind of snuck out the back door because they were afraid to ask me to write that letter, because I was so busy. So don't be afraid. Dentists like that. And if you don't know them as well, ask, can I schedule a Zoom call with you to tell you my story so you could write a strong letter of recommendation for me? So don't be afraid. Don't be afraid to ask.
Yeah, thank you guys so much. I did want to head and linked the link to the application guide where it talks about the dental experience. So it does provide a little bit more insight of, for example, you guys mentioned the dentist name, so that's information's also in there in the guide for you guys. And also, I know that I started working here back when in the middle of COVID, and so a lot of people were nervous as to how are they going to get their experiences. But I think that was still very relevant. How to go about asking people. And I know for myself, I'm an introvert, so I can understand how scary it could be to ask someone to write a letter for you. Okay, so we'll go ahead and move along. Healthcare experience versus dental experience. So I know we talked about the dental experience. We also have a healthcare experience category as well in the activity section. And right now, the way that's set up is that comes up first before the dental one, unfortunately. So sometimes applicants get confused as to what is supposed to be in our dental and what is supposed to be in our healthcare.
It's tricky sometimes. I would just say right off the bat, I don't want to, I'll let Dr. Lemke jump in, but I'll just say this, and I think San Antonio's same way. If you mix it up, if you get one in there in this one category, it is not the kiss of death. We're not going to go, oh my gosh, they put that in the wrong category. Throw that application in the fireplace. No, because it's sometimes there is a gray area. So know that at the first and read the instructions from TMDSAS. But then I'll let Dr. Lemke jump in here and
I'll give a plug to the application guide. Like Zulema said, it describes exactly what should go in the healthcare section, and there's like a caution or disclaimer or something right at the beginning of it that says, this, if you're a dental applicant, this is healthcare related that is not related to dentistry. I don't know how they phrase it, but it says that right up top. So it's always a good idea to have that guide open in another window or tab while you're filling out the application. But to me, it's, it's shadowing in a hospital physician's office, scribing. It could be working as a pharmacy tech, any kind of experience that is healthcare but not related to dentistry. So that should be obvious. But I do think that healthcare experiences have value, and I there's a certain number of people who apply in dental school every year who might have started college as a pre-med student, and maybe they do have some experiences related to shadowing at a hospital, for example. And people shouldn't be afraid to put that in the application, because that experience has value even to a dental applicant. We train our students in how to treat patients with various systemic disorders, and so there's always something to be gleaned in any healthcare setting, I think, that can provide context for being a dentist. So don't be afraid to list them.
Yes, I agree. I mean, dentistry is healthcare of the oral cavity. It's medicine. We're physicians of the oral cavity, but even beyond, because everything we do impacts everything. We don't just drop it off here. So our students are trained. They've got to know more than just teeth numbers and they've got to know below the neck as well. So I would say this: if you're doing things where you're not directly shadowing a dentist or working in a dental office, for example, a T-mom, for example, you can put that under dental experience. I've seen it under healthcare experience, but be specific on what you did. So were you shadowing a certain group of dentists? Were you doing sterilization? What were you doing? We wanted to kind of know that. So be sure and write that out. But again, I think both make a person a well-rounded individual, and you don't get penalized. Oh my gosh, they did all the stuff in the hospital the first 2 years. They must want to go to med school.
Yeah.
No, not if you've made the point and you've done the dental experience and you've made the point of the application. Dentistry is my profession. You don't get beat up for that.
Yeah, that's actually a question I remember getting a while back when I was answering the phone, and someone had said, "I thought I wanted to do medicine, and now I know that I want to do dentistry, but should I put that? Are they going to get mad at me for choosing the wrong school initially?" And I was just like, "No, I don't think that's the reason for tossing out your application." And while we're at it, can you guys let us know, do you guys toss out applications like applicants think y'all do?
Do we what? Toss them
Do
out?
y'all toss out the application? As soon as for example, in the healthcare versus dental experience, we'll have applicants who are freaking out if they put it in the wrong slot. That means that y'all are going to toss out the
No,
application.
absolutely
No.
no. That's what I said. You don't get penalized for that, at least from our standpoint.
Not in San Antonio either.
Yeah, we're our admissions committee. We have, it's not one person makes the decisions. I mean, we all have large numbers on the admissions committee, and they're all qualified and experienced enough to be able to connect dots on applications. So, yeah.
Yeah, thank you for addressing that. And the reason why I said that is because that's the exact language.
Tossing it out.
Punch
Yeah,
and
well, the
delete.
schools toss out my application for blank, for this, for that.
No. Well, we don't do much tossing around here.
Good to know. Alrighty, so moving on to extracurricular activities and community engagement. So I know we're going to be a little bit, I think we have, just one more slide, just because I want to make sure we have enough time for these questions. Looks like we have great questions coming our way. So really quickly, for extracurricular activities and engagement, there's volunteer work, there's community involvement, and I know that in this past cycle, we did that distinction of, yes, there's community service, but there's community engagement. So anything that you guys would like to elaborate on that?
Sure. So I think that all kinds of activities that you do while you are either a student or just a member of the community, they have a lot of value, right? And you can learn skills and personal strengths and you can grow through a lot of different activities. And so make sure to list everything you do, but also, again, help us connect the dots with, what did you learn and grow and do from these activities? Like, what did you gain? And, obviously, community service, especially, which is community engagement on this slide, community service and volunteering, that along with any kind of interpersonal activity, like a club, that meets physically, that's a way to show that you are connected to other people and that you care for other people. You know how to be of service to other people. And so these are obviously things that admissions committees I value a lot. I mean, certainly ours do. And so whether you're writing about them in one of your essays or you are describing them as one of your meaningful experiences from your app, go ahead and make those connections for us about what you gained from the experience and maybe how it could make you a better dental student or better dentist. It's so nice to see that in the application. And I will give an example. For instance, if somebody works in like retail or if they've worked in food service, and I would say I'm a McDonald's alumni myself, worked in fast food when I was younger. And so when I see that on an application, I know that is a person who knows how to communicate. They know how to probably deal with like conflicts and conflict resolution. They know how to deal with unhappy customers, et cetera, et cetera. Like I know that as soon as I read it on the application, but what's great is when the applicant connects those dots for us and they start writing about, that I had this job and from it I learned how to, deal with people that are unhappy, or I learned how to deal with failure or whatever. So that would be my biggest advice on how you frame all your activities in the application.
I have to agree with that 100%. I mean, we talk about a holistic review.
Mm-hmm.
What we're looking for, again, is, as Dr. Lemke said, do you have a heart for others? And so I get this a lot of time. Does it have to be dental related? No, I would say my mantra is raise your hand and follow your heart. Raise your hand and volunteer for stuff. Follow your heart. If it's working with kids, or it's working with older adults, special needs, communities, at YMCA, where you worship, wherever it is, do what your heart tells you to do. And because what we're looking for, this is easy to judge with a GPA and DAT. We're trying to judge this. We're trying to judge character, heart, because I can tell you, if you don't really care a lot about taking care of other people, dentistry is not the right profession. It will drive you crazy. So you have to have that kind of thing. And we're looking for good teammates too. So do you work well with others? And that's the other thing we can tell. And then last thing I would say is leadership's important for us. You don't have to be the president or the secretary. If you're working, or if you're involved with community service here, look for ways that you can say, I'll take that on. I'll take that project. I'll work this. And because we want to see, are you responsible? Do you have leadership? Can you handle this activity? So yeah, it's big for us. Yeah. It's big for us.
Yeah,
can I add one more quick thing that Dr. Cooley just reminded me of? And this is just, I guess, just a hint. So if you look at the application guide, it tells you that if you are a leader, like in some kind of organization or club or team or whatever, that you can, not only list that role under leadership, but make sure that you still list that organization under extracurricular activities. Like it could be your intramural team or like a fraternity or, Muslim Student Association or whatever, because sometimes I see maybe people feel like that's double dipping and I can't that's listing something twice and I'm not supposed to do that. And not at all, because you might be a member of the Muslim Student Association for 3 or 4 years, but you're only an officer for 1 year. And so you're not you're selling yourself short by not listing your full participation. So make sure you go ahead and list it appropriately.
And I went ahead and listed the link to the leadership category and the application guide because that's the section that you can double tap in.
Yeah.
And so lastly, for research, I know that we have applicants who come in with a lot of research background from their classes, courses, presentations, etc. So any advice on how to list their research experiences?
Well, I'll just say research is not make or break for us. It makes your application stronger. We like to see that, but maybe you were working, didn't have time for research. So you don't get penalized for not doing it. But if you've done research, and it doesn't have to be dental related, it could be, the genetics of the tsetse fly or whatever it is. If it's something where you were responsible and you had to be there and you threw yourself into it and did it, yeah, that makes your application a little stronger because it shows us responsibility, commitment, and toward academic endeavor. So yeah, it makes it stronger. So go for it. If you haven't done it, don't panic.
Yeah. Same in San Antonio, that we we don't expect somebody to do research just to check a box.
Yeah.
If it's something you're passionate about, go for it. I will say, similar to what Dr. Cooley mentioned in regards to shadowing, go ahead and describe your role, your participation in the project as specifically as possible. And, if you have space to do it, or if you want to include it in an essay, you can always talk about what you've gained from the experience. I mean, it could be communication skills or presentation skills or writing skills or, scientific inquiry skills, but you can always find a way to fit that into the application. But again, for us, it shows, kind of evidence of scholarly activity, and it's great to see on an application, but definitely not a deal breaker.
Yeah.
Awesome. So we'll go ahead and jump right into the questions that we have. So this is from Sandra. Do you accept community service outside of the country? For example, in Mexico, I volunteered at food banks across the border and wanted to make sure it's acceptable.
Sure.
Yes.
Yeah.
Yes, absolutely.
All right. If we have a certification such as BLS, should we include that? And if so, where?
I would include it. I'm trying to think where.
I'm trying to think where I've seen it. I've seen it under non-academic recognition, but it's not really recognition, but it could be under healthcare experiences too.
It could be, yeah.
And then the next question we have is any tips or expectations that could make an applicant that is non-traditional with 3 to 4 gap years more competitive?
Well, that's a tough question to answer because I don't know a lot of the details there. But I would say this: we like non-traditional students. We have a lot of them. We have one of them. We have 3 students on our admissions committee. One of them he was a coach and a teacher in high school for 11 years, where he came back to dental school. So we have a lot of non-traditionals. I would say that if you've done that, the big thing is depending on when you're taking the classes for the prereqs, I would make sure that you're pretty up to date with that. And if it's been a couple years, 2 or 3 years since you've taken those, I would recommend taking some upper level science classes to make sure that you're involved in the academic process.
Alrighty.
Agreed.
Next question.
I didn't mean to take that from you, Dr. Lemke.
It's okay.
Okay. All right. I'll be quiet on the next one. So.
All right. And then the next question we have is, what are we expected to put in the chronology section for the 50 character count description? So this is a chronology of activities, and this is just like that summary, and it only limits the applicants to 50 character counts.
Ooh, that's a tight character count. I would put as briefly as possible like what the club was. Like I guess it would help if I had an example, but yeah,
And
I mean that's like just a few words, and so I would just name the activity and don't assume that we know what an abbreviation means, because we probably don't.
Yeah.
You might need to spell it out.
yeah, and this section is at the end, so it just collects everything that they've already mentioned in the
Mhm.
categories themselves with the full description
Oh,
size.
okay.
So
Mhm.
this one, yeah, it truncates it to 50
Yes.
character counts just for like
Mhm.
a quick glance, like timeline.
Mhm.
Um, we normally tell applicants, don't stress out too much about this section because it's just an overview of everything you've
Yeah.
already entered.
I
And
agree.
schools can see the individual categories, correct?
Yeah.
Yeah. Yeah.
So that would be just like, Alpha Beta sorority or volleyball intramural team or
Yeah. We don't spend too much time on that. I mean, we've
yeah.
looked at everything else and evaluated.
Yeah. I see that.
That's kind of like looking at the citations at the end of an article a little bit, right?
And they're really small.
Very small.
All right, so following up, Melody followed up with that
Mhm.
award from earlier. So this was a mock dental procedure on a tooth, I believe, making the ridges in a tooth. That's what that award was for.
Hmm.
So would this
I'd
one go
probably just
under?
I'd probably just put it under maybe non-academic recognition right up top there so we can see that's an award. Um, but it could go under manual dexterity. Either one would be fine, I think.
Yeah. Either that or, when if this was a visit, like explore the school day or something, and you did it, you might put just that little explanation underneath that as well.
Mhm.
Yeah.
Yeah, like under if it's Dr. Cooley's right. Maybe it was through one of the impressions days or some all-day pre-dental affair or something.
Yeah.
Okay. I've seen a lot of applicants with experiences with pre-dental days or
Mhm.
it's events like that. So if we had the opportunity to practice with dental tools under the supervision of a dental mentor or at a pre-dental days at dental schools, where should we describe this in the application?
Hmm.
I I would just put a little blurb underneath the explanation of the pre-dental day. We got to
Yeah.
work with
Yeah.
a dental mentor and got to work with dental. We like the word instruments instead of tools, but
Mm.
yeah, we got to work,
Yeah.
get hands-on with in the simulation clinic or wherever it was done. I hope
Yeah,
it wasn't on the live patient.
early exposure. Um,
Okay.
I'm trying to think of where I've seen this in previous examples. I feel like most applicants that I can think of in the past will list these pre-dental days in the dental experience section, um, or the healthcare experience
Care.
section.
Yeah.
Either one.
Mhm. So, from what I'm hearing, just based on what y'all have been answering, it could go either or. There's not a strict
Mhm.
place where an activity has to go necessarily.
I think that's
Hmm.
fair. I think the
Yeah.
gray area to me is like Dr. Lemke said, if it's dental related, but you're not really shadowing
Yeah.
a dentist, then I think that's that gray area there.
Hmm.
Yeah.
Okay, thanks for clarifying. Let's see. I know you mentioned T-mom, so like this is a question that asks that. In terms of volunteering at a dental clinic such as T-mom, where I helped with different activities but not under specific dentists, would this go under dental experience or healthcare experience?
Hmm. Like if somebody was working in the like checking patients in or sterilizing, I really think it could go either because the strict
Yeah.
definition of the dental experiences should be under the supervision of a dentist. But but I feel like that I feel like this leans more towards the dental experiences in my view.
Yeah.
Um,
Yeah. Yeah, I agree. I think go under either one. I'll tell you, when we evaluate that, well, there's not a magic number on dental experience hours. However, when we look at dental experience hours, um, we're not counting TMOPs. We're counting either
yeah.
direct shadowing or direct
Mhm.
working with the dentist.
Yeah.
So
Same.
we evaluate that. We would look at this, and I think that's
Separately.
great, but it wouldn't really count toward, you know,
Mhm.
what we look for. So either
Same
one's
with us.
fine.
Mhm.
Okay. Well, thank you guys so much. I did want to be mindful of everyone's time because we are at 3 o'clock. And I know we still have a couple questions. I don't know if you'll have to go right now, and if so, we can close it out.
I could take a couple of questions.
I can too.
Yeah.
Yeah.
Oh, perfect. Okay. So I know y'all are busy, that's why I wanted to make sure, but these are actually all pretty good questions. Would I list my employment, volunteer, and shadowing experiences under dental experience opposed to healthcare activities?
Hmm.
Yes, if the employment
Yeah.
is and volunteer is in a dental office.
Dental. Yeah.
Yeah.
Okay. What if you have volunteered at a dental office during doing non-dental work, like at the front desk, inputting procedure information, working on insurance information, inputting imaging and treatment into the system, etc.? Where could that go?
Hmm. I think it could go either under community engagement or under dental experience and just kind of let us figure it out on our end. Again, we wouldn't count it towards that direct clinical
Right.
participation. It would be something different.
Yeah, I agree. It go either one, but that's why it's important when you list this that you explain what you did. I mean, we want to know that, and I'll tell you that you may think, well, they'll never know. If you don't put that in there and you come for an interview and we say, oh, hey, how was that at? Tell me about your experience at Dr. Smith's office. And you go, well, I just worked the front desk, which is great because you get a feel of how dental offices run, but you want to be specific so that we know what your life has been like. So yeah, explain that wherever you put it, explain it well.
Okay.
And by the way, if you work the front office, God bless you. So
I was thinking
that's
that.
not easy. That's not easy to do. So yeah.
Okay, so this one is, do we make an entry per office we shadowed at or include them all in one entry? I assume individually, but wanted to clarify. Thank you.
I think Stephen is making the right assumption.
Yes.
So individually, as Dr. Cooley mentioned earlier, we shouldn't just lump them all together. You should break them out and include the specifics.
Many times it's dangerous to assume, as we all know, that acronym, but in this case, it's the correct thing to do. Yeah. So.
Okay, does a direct study and research course count towards research? I was required to write a 10-page literature review under a professor for a grade.
Gosh, I mean, just thinking back about the applications that I have read, in the research section, sometimes people list research that was done as part of a course. And I'm not talking about the kind of course where somebody has to, maybe they're working in a lab, and part of that is they have to register for like a 1-hour pass-fail course in order to participate in that experience. But it's an actual research experience in a lab. That would, to me, would be like a traditional research situation. But alternately, sometimes we see what Carlos is describing here, where they are part of a course, and one of the assignments in the course is like a research paper. I would say that to go ahead and list it if you want. We won't know about it otherwise. But that is not maybe to us mentally the same thing as going in and participating in the process of scientific inquiry, discovery, etc. Dr. Cooley, you feeling differently?
No, I agree with that.
Right.
I agree with that. I mean, you could list it there, but it's not going to carry the same weight as if you were actually carrying on research in a lab, doing something like that, and being that assistant. But I think it's fine to put it on there.
Yeah, list it.
So going back to that previous question, I didn't want to, I kind of made this this comment. I want to make sure it's clear on that. If you're working in one office, and let's say you work or you're shadowing for a month, and then you come back another month, I think that's okay to list that, but but you don't have to list every one, or if you're don't list every day or every week. You can list it. Just make sure it's the office. We know who the dentist is and the dates and the hours. And if it's more than one dentist, then I think you could break it out and make it a separate entry. So I hope that clarifies for him. I didn't want him to.
Yeah, thank you for clarifying. I know it can get tricky with the knowing which dentist name to put in there, also because of the description character count. So thank you for clarifying that you can break it down and just like you said. So we have 3 more to go. So can we include an RDA license? If so, where?
Absolutely.
Yeah.
Yeah.
Any specific place where it should go, or up to the applicant?
Most people list it, it seems like, in the dental experience section.
Yeah, I think so. Yeah.
Okay. We get this question in different variations a lot every cycle. But do either of your schools require letters of evaluation from professors? Is it a requirement?
This is a hard question, so I'll let Dr. Lemke go first. No, this is this is hard. I know for the non-traditionals, if they've been out a long time, we still like to see a letter of recommendation from a professor, assuming they're alive. I don't know how long they've been out of school here, but and if they've been out for a few years, again, they're probably going to have to go back and take some other classes. And again, reach out to a professor you're taking the class from. Even, hey, can I tell you my story? And I need a letter of recommendation, etc. So I don't know. What do you think, Dr. Lemke?
I mean, I will say that rare is the application that doesn't have a letter of recommendation from a science professor.
Right.
And I feel like we get the question a lot, what can make my application stand out? But some things can make your application stand out in a wrong way, and you don't want to do that. So, while we do not require a letter from a professor, there's nothing on our website that says you have to have a letter from a professor. That might be something that's worth going a little bit the extra mile to try to get. Or as Dr. Cooley said, if you've been out of school 5 years, you might be, picking up an extra class, maybe microbiology or something to kind of stay, keep your skills sharp as you go into the application process. And, certainly you'd want to try to get a letter from that professor. So I feel like I'm kind of hedging my bets on the answer here, but while we don't require it, it's definitely recommended.
And we like to see 2 letters from professors, but we've made exceptions for people who've been out for a while where it's like, hey, this is really hard. And so if they've got it from like someone they've worked, their boss, someone they've worked for that knows them very well, that counts for us. And so it depends on the situation.
Yeah, and our advice has been, while it's not required, the schools do like to see that. So thank you for backing us up on that answer. So lastly, we kind of get this question as well. What date is considered late? What date should we aim when it comes to submitting?
Well, dates considered late is November 2nd.
Yeah.
Right. So
that's really
okay. I don't know. We may have different takes on this. I tell everybody early to me is still May, June, July. It doesn't have to be May it doesn't have to be, I got to have this in by May 24th, or the world's going to crash.
Yeah.
So sooner the better. But October is still late. October is late. And
the problem with October too is that it takes a little bit for us to get the application transmitted from TMDSES to schools, and then for us to review it. And we don't invite people to interview with us like 24 hours in advance. We send those letters out earlier than that. So the later you apply, the fewer open slots for interviews you're looking at. So I basically tell people, May, June, July is fine. And August is getting on the later side, and September and October would be considered late in the game.
And we all interview, it's a rolling cycle. I mean, we start interviewing I think the third week in August. We'll interview till the last week in January, sometimes the first week in February. But you're right. It's so competitive that if you get it in October 31st, as Dr. Lemke said, there aren't that many seats at the table still available. If it's a killer app, I mean, we'll still look at it and evaluate it. And if it's like this rock, application, you'll probably get an interview. If you do not have a strong application, you can get it in 3 seconds before the very first click of TMDSES opening, and you probably won't get an interview. So it has to be strong enough. So, but sooner is better.
Thank you guys so much for that insight, because that is something they want to hear, the exact dates. And our thing is, well, it's like Dr. Cooley said, November 2nd is late. Okay, thank you guys so much for joining us today. I learned a lot with you guys, and I'm sure our applicants did as well. And I appreciate taking the time to join us. And so, any last few words of wisdom before we close out the session?
Ooh. Dr. Cooley, do you have any words of wisdom?
Well, yeah, I kind of do. I was thinking about this. Here's what I would say to any applicant, whether it's first time or reapplicant, is a couple of things. First of all, don't compare yourself. I mean, we look at all these numbers and you look at the statistics, DAT, GPA, etc. Don't compare yourself to anybody else. There's always going to be somebody less that's weaker than you. There's going to be somebody stronger than you. That's a tough game to go through. That's not only true in dental admissions, that's true in life and everything else. So don't compare yourself to anybody else. And the other thing is, take a really honest look at your application, either first time or reapplicant, and have somebody help you, a health profession advisor that looks at it. If your GPA is not as competitive as you need it to be, but you've done 1,000 hours of community service, doing more community service isn't going to help your application. You've got to look at it, how can I strengthen the areas that need strengthening? So don't be afraid to take an honest look, to have somebody else that cares about you that's going to give you an honest appraisal. Do that. Don't compare yourself to anyone else, and then just go for it and be strong and be the best person you can be.
Wow, I don't think I have anything to add to that. Other than certainly have somebody read your essays for you, good feedback there. And also that don't be concerned about the timeline that somebody else may be imposing on you, whether it's your own expectations that I must rush my way through undergrad and then go straight into dental school, and if that timeline doesn't work out for me, I've failed. No, that is not true. Sometimes a gap year can be part of a really good strategy to kind of do what Dr. Cooley says, and make sure that DAT is where it needs to be, that GPA is good, that you show us that you've taken some recent coursework and can perform in that coursework. You kind of have to think strategically when you apply, instead of maybe going into it with a lot of assumptions and expectations. And that's where advisors and pre-dental clubs and all of that support network, as well as TMDSES, kind of come in with good advice and help for applicants. So use all those resources.
Yeah. Amen.
Alrighty. Thank you guys so much again.
Thank you.
And to everyone watching, we'll see you again next time. Bye, everyone.
Thanks,
Bye.
Zulima. Bye,
Thank
Dr.
you.
Lemke.
Bye, Dr. Cooley.